Good day, and welcome to the Josiah Macy Jr. Foundation's informational webinar, Artificial Intelligence in Medical Education, a grants program to advance innovation. I am Peter Goodwin, Chief Operating Officer and Treasurer at the Josiah Macy Jr. Foundation. The purpose of today's webinar is to provide you with an opportunity to learn more about the Foundation's new RFA grant program. We will share with you the vision, highlights, and information about the program, including the application and selection process. Our agenda today is in two parts. During the first part, you will hear a presentation about the grants program from our Chief Program Officer, Dana Levinson. The second part and the remainder of the time will be devoted to questions and answers. During the Q&A session, we will welcome two guests who served as members of the planning committee for our recently concluded conference on AI in medical education, Dr. Eva Agard and Dr. Cornelius James. We are grateful that they are joining us to lend their expertise, and we will introduce them formally a little later in the webinar. At the end of the Q&A session, we will spend our last minutes on some details you will need to know in order to submit your online application. Before we get started, a few housekeeping items. This session today is being recorded. The audio, video, and transcript, as well as the presenter slides, will be available next week on the Foundation's website, www.macyfoundation.org. We have live closed captioning for today's webinar. And in the chat box, you'll find instructions for accessing that live chat webinar. You can use the Zoom tool, or you can link directly to the live chat itself. If you are having problems accessing these services, you can enter it into the Q&A function on your Zoom screen, and a staff member will help you. The chat function on your Zoom screen is currently disabled and will be throughout the webinar. The Q&A function on your Zoom screen is active and will be throughout the webinar. Please use it to pose questions to the presenters that relate to the content of this webinar. You may also use it to comment and like the questions that are being posed and answered. We will answer as many questions as we can at the end of the prepared remarks. And now I'm pleased to introduce the Chief Program Officer of the Josiah Macy Jr. Foundation, Dana Levinson. Dana?
Thank you, Peter. We are very pleased to announce Macy's newest RFA on artificial intelligence in medical education, a grants program to enhance innovation. We recently completed a conference on this topic in November, and as a follow-up, we are now launching a grant opportunity to fund demonstration projects that explore the potential uses and applications of AI in medical education, with the goal of improving implementation, outcomes, and experiences of faculty and learners. It is important to mention that while other healthcare professions are clearly affected by these technological advances, at this time, and for this particular RFA, we are supporting applications only in undergraduate and graduate medical education. But as many of you know, the Macy Foundation does have a very strong priority area in interprofessional education. And as long as the program does include and is involving of medical education, we would be very happy to receive applications in interprofessional education. Our vision is to help the leaders and educators in medicine embrace the utilization of AI and to leverage these tools as part of the curriculum and the training of future physicians. By supporting projects that explore the potential uses and applications of AI, the program aspires to advance our understanding of what responsible, effective, and ethical use of AI in medical education will look like in the immediate future. Our hope is that by providing 2 years of support for innovative educational interventions, grant recipients will help identify pathways for utilizing these technologies to make positive and meaningful changes in medical education at their own institutions and preferably beyond. We will select up to 3 projects for support, and each recipient will receive up to $100,000 each year for a 2-year project. Project totals must be inclusive of indirect costs, which are capped at 10%. In terms of eligibility, proposals should directly affect the educational experiences of future physicians. with a specific emphasis on education that is provided in the clinical learning environment. As a demonstration of institutional commitment, letters of support will be required from institutions, departments, and/or health systems, whichever is relevant. We would also like to see a demonstration that the necessary technical expertise exists and is available to project leaders, such that the proposed project can be executed. We will be paying attention to feasibility, given the available resources and a time frame of 2 years. And finally, we will look at the innovation of the proposed plan. We will look at the ability to sustain the project after the period of support ends, and we will look at evidence of replicability, generalizability, and scalability, such that other institutions can benefit from this work. While this is not required, there will be preference in our review to those projects which meet one or more of the following criteria: a demonstrated link to improved educational outcomes, a demonstrated link to improved clinical practice and patient outcomes, and a relationship to one or more of the 3 Macy priority areas. These are listed on our website in much more detail, but at a very high level, they are promoting diversity, equity, and belonging in health professions education, increasing collaboration among future health professionals, and fostering learning both in and learning from high-performing interprofessional teams. And finally, preparing future health professionals to navigate ethical dilemmas. We are also interested in projects which involve multiple institutions collaborating together. And finally, we are very interested in projects which are co-created with the participation of learners. So what is the next steps in our selection process and review? Letters of intent are due on Monday, February 3rd, before midnight Eastern Time. We are convening a special review committee of those who have expertise in artificial intelligence, in medical education, or both, and they will provide the first review of all completed letters of intent. Finalists will be selected and invited to apply for a full board grant by March 3rd. Those who are not invited to apply will also be informed at this time. Grant submissions for the full board grants are due on Wednesday, April 23rd, again before midnight Eastern Time, and by the end of May 2025, all finalists will be notified of their application status and whether they have been selected for the awards. Funding will commence immediately on June 15th, 2025, and run through June 14th, 2027. So we are going to move now to the Q&A portion of the webinar, which is where we like to spend most of our time. Please enter any questions that you have about artificial intelligence and medical education RFA into the Q&A function on your screen, and we're going to try to answer as many questions as we can. And I would like to invite 2 guests who also served as members of the planning committee for our recent Macy conference on AI and medical education to join us. First, I want to introduce to you Dr. Eva Agard, the Carol B. and Jerome T. Loeb Professor of Medical Education, Senior Associate Dean for Education, and Vice Chancellor for Medical Education at the Washington University School of Medicine. Eva, I'd like to give you a moment or 2 to share how you became involved in Macy's efforts to create consensus around the utilization of AI in medical education.
Thanks, Dana. I'm really excited to be here and have really enjoyed my time working with the Macy Foundation on this project. I initially became interested in this really in my local institution, thinking about how it might be useful as a tool to help reduce some of the burden associated with education, and then was asked to partner with Bob Wachter at an ACGME conference to talk about AI in medical education and its implications. And that's how I initially became involved, and since then have really learned a lot from the people who've been involved and really enjoyed thinking about what all of the potential opportunities are, as well as the challenges facing us associated with AI in medical education.
Thank you, Eva. I am also excited to welcome Dr. Cornelius James, who is a clinical assistant professor of medicine and pediatrics at the University of Michigan. Cornelius, if you want to turn there you are. Would you like to share a little bit of the background on your very impressive body of work in AI and medical education?
Absolutely. Thank you, Dana, for that introduction. And as Eva said, I'm also excited to be here to just kind of listened to many of the questions that are out there related to this very, very rapidly evolving but paradigm shifting field of AI and medical education. So I am very interested. Well, I'll start by saying my research interests include digital health, and as many on this call know, artificial intelligence is kind of a part of that broader field of digital health technologies. But I also teach evidence-based medicine at the University of Michigan. So I'm very interested in clinical reasoning. So a little while ago, I really started to kind of think about how these technologies would specifically impact diagnostic reasoning. That led to a fellowship with the National Academy, eventually developing curricula that were designed to kind of teach learners across the continuum of medical education to use these or use AI, machine learning based technologies in their diagnostic decision making. That eventually led to partnerships with the AMA, developed curricula with them, and then also currently working with the Gordon and Betty Moore Foundation and Society for Teachers of Family Medicine to develop curricula that are specifically designed to kind of teach primary care physicians to use AI and machine learning technologies in their clinical practice. So I've had a lot of fun on the committee, just as Eva said, learning from learning from that group. And I'm also interested in kind of hearing some of the questions that you have, and I'm hoping that we'll be able to effectively address those questions. Thank you.
Well, the good news is, Cornelius, the Q&A is getting a lot of activity, but we also received some questions that were submitted in advance. And so we're going to turn it over to Peter, who is going to share the questions that have come in. And Dr. Agar, Dr. James, and I will do our best to answer you.
Thank you, Dana. And thank you all of the attendees for submitting your questions. As Dana said, we received a number of questions in advance of this webinar. We'll take a few of those first before we dive into the ones that are coming in live right now. First question to the panel. Would the funding be applicable to growing existing curriculum, or must all program offerings be newly created?
Great question. Eva, do you want to take it?
Sure, I'm happy to. So while I think either is potentially fundable, I think one of the challenges of using existing programs is you have to be really clear about how this is changing things and not funding existing programs. So what will be the new innovation? How will it grow? How will it change? How will it be different is going to be critical to be very clear about in any application that involves an existing program.
Cornelius, I see your hand up.
And I'll just really briefly add to that. I mentioned kind of in my introductory remarks that I direct the evidence-based medicine curriculum at the University of Michigan Medical School. So many of you can potentially appreciate the impact that AI machine learning is going to have on that and other things like health system science, clinical reasoning curricula, doctoring curricula, et cetera. And I'm focusing a bit there on undergraduate medical education, but you could also appreciate that it could potentially transform the way that those particular fields are taught and or what's taught in those disciplines, I should say. So I totally agree with what Eva stated, but at the same time, it is possible to kind of develop programs or curricula that are kind of almost, well, I guess it's kind of okay to add on to currently existing curricula. But as Eva stated, we definitely want to see that it's it's innovative, and it's not just kind of like a brief add-on, but it kind of transforms these curricula in the way that we anticipate that they could potentially transform them.
Thank you. This next question is: the Macy RFP interested more in the translational application of AI in medical education or in exploratory research applications?
That is a great question. We specifically use the term demonstration project because we are looking for the application of AI. And while this is not research per se, of course, we are interested in an evaluation component as well. So I would say that we are not interested in pure research, but at the same time, we do expect that projects be evaluated and assessed rigorously. Eva, Cornelius, anything to add?
No, agree.
Well, thank you. Next question How innovation will be defined in this rapidly evolving field, and how will we know if it's successful or scalable?
Eva, I'm going to let you start, and I'm pretty sure other people have things to say about this too. That's
I
a big
think that
question.
this is a really great question. I think it's really hard because really things are changing almost daily and certainly weekly in this space. And so I think the answer is that we'll be looking at it at the time for its opportunity for innovation. At least that's the best I can say at this point, and that we'll really be looking for opportunity for it to have significant impact as an innovation, as part of the broad goals of the application. I also feel like it should be while it may not be an innovation in another space, we're really looking for innovation in the education space, and specifically the medical education space. So that ability to even apply an innovation to the education space where it hasn't been previously applied would be, I think, also potentially of interest, but please correct me if anybody feels differently than that.
No, I agree with you. Thank you for that answer. I would also add that judging what is innovative is not something that can be managed by one person. This is why we are assembling a review team, and why each of the letters of intent that are submitted will be given more than one review by more than one person, because we need to rely on those who have broad expertise to give us feedback on innovations that will still be valuable and important 2 years from now.
Thank you for that. Let's turn to some of the questions coming in from the attendees today. This is a question that's been asked many different ways by many different attendees. When you say, quote, medical education, end quote, does this mean undergraduate and graduate education pursuing MDs, or also nursing, pharmacy, and other healthcare related disciplines?
Yeah, I would like to reiterate that at this time, and for this specific RFA, we are narrowing our focus to those projects that are based in undergraduate medical education and medical school, or in graduate medical education, residency, and or fellowship. As I also said before, we are not only interested, we are eager to receive interprofessional focuses on these applications, but the projects must be coming from medical schools and must incorporate and include medical education.
Thank you, Dana. Next question. This attendee wants to understand, is the priority to be in the clinical learning environment more than the classroom?
We do have a preference for the clinical learning environment because of the impact of the clinical learning environment in shaping future practices and behaviors. We know it to be a very powerful space in which education happens. That is not to say that we would not consider didactic experiences, and we rather expect that there will be a combination of both didactic and clinical focus in the applications.
And I guess I would just add also, we imagine that we might see some that are simulation based, or not necessarily didactic in the traditional sense, but involve classroom based or simulation based environments. Cornelius, do you have any other thoughts on that?
No, I agree, as far as kind of considering the potential multimodal methods that could be used to instruct learners and ensure that they're adequately prepared, and or to use these technologies, for teaching and learning purposes. So totally agree with that.
Next question. How important is it to include an evaluation/research component that looks at the effectiveness of the proposed project?
There is an outcome section. We are interested in the evaluation component. It is a wonderful idea to have a great creative and innovative curriculum, but knowing how it is received by learners, knowing what the impact is on learning outcomes is very important.
Can I also briefly add there that also allows us to kind of, in some respects, kind of determine that scalability, generalizability, impact
Mhm.
that it's going to potentially have on other institutions. So that evaluation component, I see that as being pretty important.
Yeah, completely agree, Cornelius. Well said.
There's a number of questions here about the collaborating institutions. This question is looking to be more specific. Are you looking for a certain number or a certain type of collaborating institutions in this RFA?
We do not have a number in mind. I think that multiple institutions involved in the project gives it an opportunity to show the kind of scalability and spread that Cornelius just talked about. But we're also mindful of what's reasonable and possible to accomplish in a 2-year project of this size. So I think that the number of institutions selected needs to be guided by those considerations. Cornelius, jump in.
Can I just also add in there, we also consider the team, right? So that may not necessarily be, excuse me, at another institution, or it may not necessarily be multi-institutional, although that's great. But considering the multidisciplinary nature of the team, for example, the medical educator, clinician, maybe computer scientist and or engineer, or medical student or resident that's also involved with the team, it just allows for more diverse perspectives, and potentially allows for a more effective and or scalable product.
Just to add to that, that goes back to the evaluation criteria around feasibility. Do you have the right members of the team to actually accomplish what you say you're going to accomplish? And then also the other criteria of co-production with learners and learner engagement in it, which is also part of the criteria. So those things are preferences and favored, and feasibility will be a critical piece of the evaluation process, I'm sure.
I'm going to turn back to some of the questions that were submitted in advance of this webinar. Can MDs still in residency apply for this grant?
That is a great question. We have at the Macy Foundation funded grants that had residents as PIs. However, not every institution has the same policies about allowing residents to be principal investigators. And so more often than not, we see learners involved not as the PI, but as a co-investigator. I also think that the nature of training can make this complicated. This is a 2-year award. Residents frequently have extremely demanding schedules. And so we understand that their participation in a project goes in and out depending on what else is on their learning. I mean, their learning needs to be prioritized, obviously. So while we will, in fact, look at an MD in a residency program as the PI, I think we would need to see structurally how that would work, such that that person is not sacrificing their education in order to participate in a research project.
Thank you. Next question. Can you provide some examples of a demonstrated link to improved clinical practice and patient outcomes?
I'm going to throw this to Cornelius.
Sure. Yeah, so I think a great example, there are some at Michigan that have done some great work in this area as well, but I think the surgery literature provides a pretty good example of kind of linking, assessment of learners or trainees' surgical skills, and also actually predicting how they'll do in the future. When it comes to performing various surgeries, whether it's cholecystectomy or colectomy or something along those lines. But I think that's a great example of where you can not only kind of provide that assessment using AI machine learning methods, and or even feedback, but where you can do that, but then you can also kind of predict how things may go, and also have interventions in place that allow us to kind of see how a learner potentially did after interventions that were sort of guided by AI machine learning assessment feedback, and then to kind of evaluate patient outcomes using or relate those patient outcomes to the data and or analyses or recommendations from a AI machine learning based assessment or feedback method. So I think that's like one good example. Certainly there are others out there. I'm sure others can think of many innovative ways to kind of connect those outcomes, the educational and the patient outcomes. But I think the surgical literature, and I'm happy to provide some articles if anyone's interested, but I think they provide a pretty good example, though.
Thank you, Cornelius. Are health professions education programs that prepare faculty to teach, research, and lead eligible to apply?
That is a really important question, and I'm going to ask Eva and Cornelius to give me their thoughts about this.
Sure, I'm happy to start, and then would love others to join in. I think that while faculty development is critical to all these initiatives, where any faculty development initiative would have to have clear linkages to learning outcomes for trainees. And so while it can be a part, I think it would be hard for it to be the primary focus given our goals for this RFP. So definitely see it as a part of it, probably not the only part, is the way I would come down. Cornelius?
I totally agree with that. Focus on learning outcomes and even icing on the cake, patient outcomes. So totally agree with that.
Just to add that the Macy Foundation's priority is about improving the education of future health professional. And so learners are obviously central to everything that we do. And while faculty development obviously has a huge impact on learner experience, we would like to see learners involved really in everything.
Thank you. I'm going to turn back to the live questions coming in right now through the Q&A box. Thank you all for submitting them. This is one looking for clarification. Is the grant intended to foster the use of AI as a tool in medical education, or is it about education about the use of AI in clinical decision making?
That is a very important question. Cornelius, why don't you start off? I'm sure we all have a little something to say about it.
Yeah, so I agree. Great question. And I think the easy, simple answer is like for sure both. But at the same time, there's overlap. Like that example that I just gave related to surgery, there's like some overlap when it comes to even those two, when it comes to using it for teaching and learning and versus like teaching trainees or students to use these technologies. There's some potential overlap. And I think that increasingly we'll kind of see those lines kind of blurred, especially as we talk about like a learning health system, right? Where we're using these various types of data and things like artificial intelligence, machine learning to inform like what we teach, how we teach, et cetera. So I totally both of those. I would say what I'm seeing get a lot of interest right now, just like as I'm kind of going around and having these talks or giving talks at different places, definitely lots of interest. And it's super important when it comes to using these tools for teaching and learning, but not seeing as much traction when it comes to actually teaching learners or trainees or clinicians to actually use these technologies. So, I think both of them are super important, and I'm super hopeful that we'll get, proposals or letters that will reflect interest in both of those.
Thank you. Next question is about collaboration again. Is collaboration with industry partners allowed, especially in the world of technology and innovation, where medicine and tech companies are starting to work more hand in hand?
That's a wonderful question, because we, of course, collaborated with those who are involved in tech companies when we formed our conference and its agenda. The one thing that I would say is related to eligibility, and that is that the Macy Foundation only considers proposals from 501c3 organizations and public entities. So while this collaboration with a tech company is absolutely fine, the proposal requests must come from and the funds must be awarded to a tax-exempt organization.
Thank you, Dana. This question somewhat follows on that. Can work supported by the Macy Foundation be commercialized beyond the grant? Are there any strings attached to the funds?
I'm going to let you answer that a little bit, Peter, but I'll start off because that is a really important question. The work that is created is intellectual property that belongs to the person who created the work. The Macy Foundation expects to receive, when you publish or present, we would like to have the funding source acknowledged, as by the way, it would have to be for any conflict of interest, statement. But in terms of future commercialization, I'm going to turn that to Peter because I think he can better or more clearly answer that question.
Well, with always tricky questions, the answer is always it depends. But let me at least take a stab at it. First of all, the foundation is a nonprofit organization, and the funds that we award need to be for a charitable purpose. And so, strictly speaking, we can't award a grant that's going to be used in a for-profit entity to generate a profit. That would not be characterized as a charitable purpose for us. However, if there is a product that is to be commercialized, which would be owned by the recipient, as Dana outlined, we would work with you to develop a structure where a certain amount of funds would be set aside for a charitable purpose so that we could demonstrate that in fact there was charity that still came out of this this activity. So I hope that's not too complicated, and I would love to get to the point where you had to negotiate and talk that through with one of you. But for now, I think the door is yes, you can, and there are some strings attached. We'd have to work through that when the time comes.
Mm-hmm. Thanks, Peter.
This next question asks, what about the use of simulation centers for AI in medical education?
Eva?
Yeah, I think that was what I was getting at when I was talking about simulation, virtual reality. These kinds of environments seem very much aligned with something we might be interested in hearing about, and could also lead to information about clinical outcomes and certainly educational outcomes. So I think that would fit within the scope from my perspective. Cornelius, do you have other thoughts?
No, totally agree that, at least in my opinion, I do see simulation, especially given where we are right now, playing a significant role in this particular space. So totally agree.
Next question. Will projects that are directed towards GME processes, such as feedback, milestone evaluations, etc., would they be considered?
My answer would be absolutely. The potential of these technologies to support the processes of learning is huge. And we are particularly interested in those processes of learning which directly engage and affect those who are doing the learning. So while a process that looked at utilization of technology for accreditation processes, which of course it can do, is slightly less interesting to us than than the kind of processes which provide feedback to learners and achievement of milestones, because that is a very important component of how residents themselves understand that they are moving through their education. Eva and Cornelius, I'm really happy to have you weigh in here.
I really agree. I think this is one of the great potentials of AI and in medical education, and especially for some of us who are really interested in the precision education space. I think this is an opportunity to explore some of those things as well.
Thank you. Will applications with multiple institutions be prioritized over multidisciplinary single institution applications?
That is a great question. I would say that our priority would go towards an application that was well designed, that had the potential to have impact, that was innovative, and that was going to lead to better learner outcomes and we hope better patient outcomes. Whether it's more than one institution or a multidisciplinary team within an institution is probably less important than those other considerations. But I'm going to ask Cornelius what he has to say on the topic.
Yeah, I think it kind of goes back to an earlier question to some extent. We are very aware, like while the multi-institution piece is great, we are also aware that there are some institutions that have lots of intellectual and or material resources that permit completion of a specific type of project. But then we're also aware that there are other institutions that do rely on relationships with other institutions so that they can meet the goals, either educationally or in other ways, that they have for a particular project. So I totally agree with Dana in that it's going to all depend upon the strength of the application and the potential impact that it could have on the education community, the broader education community.
Thank you. I'm going to go back now to some of the pre-submitted questions, and we'll touch on a few of those. The first one is, would it be advantageous to expand an early prototype in AI that is part of a Macy for this or establish a new focus for this? I'm sorry if that wasn't clear. I'm just reading the question as it came in. Dana, is that helpful?
It sounds like you're asking if an existing prototype can be assessed and evaluated through this mechanism. And I think my answer is yes. To the extent that I think I understand the question.
Yeah.
Even Cornelius, if you understand it better, please weigh in.
Well, I guess I heard it as, what if there's an existing Macy sponsored project?
Oh.
And then that's the way it read to me.
Well, let me answer that question. If we are already sponsoring a project, we will not entertain an application for providing funding for the same project. I have received questions, if you already have a Macy grant, can you apply for this one? And the answer is yes, as long as the projects are distinct and separate. But having provided funding through one mechanism for a program, we won't provide funding through a second mechanism for the same program.
Thank you.
Cornelius, do you want to add something?
Yeah, just really quickly, I guess one of the other ways that I could kind of think about it is, are we talking about like a model, like a machine learning model that has been developed and we are anticipating deploying or piloting that model in a specific setting, and whether or not that's education related and whether or not that is appropriate is absolutely, versus developing a model from scratch, potentially using these funds. I think that the latter seems like it would potentially be a bit more difficult given the 2-year time frame to kind of, especially if you want to kind of show those educational outcomes and the impact. But a model that's been developed and you're now looking to use that model in a given educational setting, in my opinion, that seems very appropriate and like a reasonable thing to do. If I'm understanding that question correctly.
There are many ways to answer the question, obviously. Thank you all for that. This next question, is this program geared towards innovation in using AI in medical education or having learners ethically use AI to improve patient care?
That is a great question, which we are getting a lot of, and which I understand to be a very important one. The answer is we are interested in both. We are interested in the utilization of AI to improve the processes of medical education, but we're also interested in curriculum that integrates AI as a tool in helping future health professionals in their future clinical practice. Even Cornelius, I'm happy to have you guys weigh in on this one because this is an important question that we hear a lot.
I guess I completely agree with what you just said, Dana, and I guess I would just add that it would be really, I think, valuable in the application to talk about ethical implications. We're very interested in ethical implications for either of the kinds of ideas that are being promoted. So making sure that having some component of that or thinking about that and the implications of that will be one of the lenses by which I think we'll be looking at these applications. Does that help with the ethical piece of it?
Thank you. This next question is, as AI is changing by the minute, what happens if things change so much so that the project has to change shape as well?
Well, that's a wonderful question, and that is certainly a scenario that we can all envision happening. In such a scenario, should someone be awarded a board grant and find that the premise of that grant has evolved to a point where what they propose to us and what they now want to do is very different. And by the way, this does happen, and not just in AI. We would then have a conversation with the grantee. They would provide an updated work plan and set of priorities to us. We would work with them and evaluate and assess if this was something that we felt comfortable in continuing our funding. But without more specificity, I don't think I could confirm that that would be fine. I think it would be a conversation that we would have to have. And we, of course, are not interested in not working with those that we award funding to. We're very interested in doing that. And we do understand that this is a fluid field and one that we have to be equally flexible in. Cornelius, happy to have you, Vance.
Yeah, I'm just gonna just throw out there, and this is kind of, I guess, just my opinion, or just at the same time, like, so totally this could happen, but I guess I kind of see that as potentially being a bit less concerning, or that type of situation, because again, these grants are going to be fairly innovative and creative and new, and they're going to be looking to expand or create new knowledge or generate new knowledge, et cetera. So totally appreciate that it would be possible. And I agree that this field is moving pretty fast. But given the level of innovation that I think we're kind of anticipating with this grant, I think I'd be a little less concerned about that happening personally.
Thank you, Cornelius. This next question gets at the maturity of the project at the LOI phase. And it wants to know how the attendee is asking how much weight is going to be given to the technical demonstration, for example, pilot data of the feasibility of this during the initial LOI phase.
That is a good question, and it's going to be hard to balance because this is going to be a pretty brief application, because we don't want people to write 20 pages for a letter of intent. It's really more like 5 or 6 pages. Yet at the same time, we do need to know that the technical expertise exists to do the project, and that the technology that is being utilized is one that works. So, we will allow for people to upload additional appendices, but we would like to see that information provided, because our reviewers, I think, are going to really need it.
Yeah,
Thank you.
I was thinking, the way this question is written, it's talking about specifically like pilot data. I think that depends on whether what you're proposing doesn't seem feasible on face value to some extent. So because these are demonstration projects, not research projects, I think, the burden of proof, it depends on what the burden of proof is that you need to demonstrate that what you're doing is reasonably feasible, with both a combination of who your team is, what your environment is, and the support that you need to complete it. And I feel like that sort of gets at some of the other questions that are in the chat, which seem to be very focused on, do I need to show this or do I need to show that? And from my perspective, this is like, who the application comes from is less important when you're talking about like, should it come from this department or the school or whatever, than that you have demonstrated that you have the support of the people you would need to in order to be able to implement that project. So if you don't have support, for example, from a curriculum committee or from a leader of a curriculum committee or from an associate dean or something like that, but you're saying you're going to completely revamp some X, Y, or Z curriculum, as a person who knows a lot about LCME, I will tell you that's not possible. So I would be looking for that kind of information that you actually have buy-in for what you're doing. Similarly, I would think from a technical perspective, we'll have technical experts who will be looking to sort of say, is this even possible? Or is this sort of fantastical thinking? So if you think it looks like it might be fantastical thinking, then you might need to show pilot data. if that makes sense in terms of just the way that I think about it.
Thank you, Eva. Next question is getting at other funding. If the project is already funded through another agency, say NIH or some other granting agency, and the Macy grant proposal adds a new and important dimension not covered by this other funder, is that something that would be eligible under this RFA?
I believe so, yes, as long as that which is being added for Macy's support is a distinct and new element to the project that is currently underway.
Okay, thank you. We keep returning to this question that keeps coming up again, so I guess it's worth the panelists spending a few minutes on it at the request of this one attendee. Could you share your thoughts on the distinction or the competitiveness between applications using AI versus teaching about AI?
I will weigh in just on the term competitiveness. They are both equally competitive in the process. The innovation, the feasibility, and the rigor of the project will be more important than whether it is in one camp or the other. But I do think that it'd be great for Eva and Cornelius to talk again about this, because it is an important question.
Yeah. So I'll just say, and I guess kind of in reference to my comment, I'll say my comment earlier was related to kind of like what I've been hearing about, or what things that I've heard kind of on the speaking trail when it comes to interest. And my point in that comment earlier related to hearing a lot about using it for teaching and learning wasn't to say that that's more important, nor was it to say that using AI or teaching clinicians how to use, or teaching learners to use AI is more important. It was just to say, let's it's important, or this group, or this the planning committee and the review committee, those that will be reviewing the letters of intent and applications, are considering both of those equally, right? So we recognize the importance of these technologies in for teaching and learning in medical education, but we also recognize equally important is the need to ensure that trainees, students, et cetera, clinicians are prepared to actually use these technologies in clinical practice. So equally important.
Thank you, Cornelius. Completely agree. Very well said.
We're going to return to the theme of collaboration. This question is, can we have international collaborations or collaborators under this grant program?
So we accept applications from in medical education for those schools that are accredited by the LCME, or the LCME analog in Canada is, I think it's CACMS. So medical schools or Canadian schools that are accredited through that process can apply. If the school is applying, is from a US school, and they are collaborating with an institution that is overseas, that would be fine. But the application itself cannot come from an international school.
Thank you. This is a question related to the funding within the grant? Are there restrictions in how the funding can be allocated? For example, are there limits on how much may be used to fund investigators' time?
I can answer that question. We do not put those kind of limits in, and yet we will look at the budget and we will look to see that it is aligned with the goals of the project. We get a question a lot, like, do we use the NIH salary cap? And we do not. The one thing that I will say is that there are certain expenses that we will not reimburse, and those include construction, renovation projects. We're not going to build a simulation center for a school. Those are not allowable costs. And when you go through the eligibility checklist, that is the very first page of the letter of intent, you will have a very clear outline of that, which would make an application ineligible. In terms of the amount of time supported, it needs to be consistent with the amount of time that people put in to making sure that a project runs successfully.
I'll just add that that LOI checklist is already live on the website. And so you can, I went through it today. So it's available. You can go through it and it is quite clear.
Yes, you can preview it on the website.
Thank you. Next question asks presenters, how do you define learner in the context of this RFA?
I would say we are defining learner as someone who is in medical school or who is in a residency or fellowship program.
I'm sorry, I'm scrolling through these questions. I'm trying to find ones that we haven't asked already. Let me go back to one that's pre-submitted, if you will. What are the expectation of grantees under this program to balance AI innovation with bias, data privacy, and other ethical issues in medical education?
That's a very, very important question, and I'm going to ask both Eva and Cornelius to weigh in on it.
Cornelius, you want to go first?
Sure. So there are, and this was a conversation that we had as a planning committee for the recent conference. There were just some things that we believe should kind of be a thread throughout many of the things that we do or think or do related to AI, and ethics and bias and data privacy, things along those lines are things that we kind of see weaving themselves throughout any project related to like AI machine learning. Doesn't have to necessarily be the sole focus, although that is possible for that to be the main focus of a project. But as Eva stated earlier, something in there related to how we are going to ensure, for example, in the RFA, I believe we mentioned things along the lines of like HIPAA and FERPA and so on. So just kind of ensuring that the reviewers of the letter of intent or of a full proposal are confident that patients will be protected, that learners will be protected, that they're going to maintain autonomy when it comes to data and so on. Just kind of providing those assurances. I think it would be very well received by the reviewers, but then also the bias piece when it comes to use or how a model's actually, just kind of considering all of those things and perhaps including how they would potentially be addressed. I think it's a good idea. Eva, I don't know if you have any other thoughts related to that.
No, I really agree with everything that you said. And I do think there's a lot of interest within the committee about thinking about, in general, what are the ethical implications of AI as well. And so as you think about moving away from actual AI tools, and if you're thinking about curriculum, for example, as your implementation, I think some of us would be particularly interested in seeing how you're thinking about and incorporating concepts of ethical use, ethical implications, downstream implications, et cetera. So really, I think really keeping that ethical use, but also the ability for us to think carefully about equitable use are important considerations in thinking about your project.
Thank you. We are approaching the top of the hour. There are many questions that have come in. I'm sorry that we can't answer all of them. This will be our last question for today's webinar. Can you please provide some more information on what will need to be submitted by those invited to submit a full application?
I cannot provide complete information on that because that is still a question that we are working out. Obviously, it will be a much longer proposal and will likely ask for a great more detail about the components of the project, the work plan, the qualifications of the principal investigators, as well as the co-investigators. We are accepting very limited information on the people involved in the letter of intent. And the budget will actually be a much more rigorous budget.
Thank you, Dana. Let's turn to the wrap-up portion. I'll take just a moment to give you some additional information before I turn it back to Dana with some concluding remarks. For this program, we are utilizing an online application. To access the online application, you must first go to our website, www.macyfoundation.org, and click on the Grants button in the navigation bar. From there, you can go to the AI Medical Education page. For your convenience, the URL is displayed on this slide. From there, click the Submit a Letter of Intent button to learn more about the application process and to access the online application platform. To apply, you will need to register for an account on the online application platform. You will also need to get the tax ID for your school as part of the registration process. Once you've registered and logged in, you may save and return to your application as often as you like prior to submitting it. If you have any questions during the application process, you may email us at info@macyfoundation.org. But before you email us, we encourage you to visit the AI and Medical Education Grants Program page on our website, which has a number of useful resources, including how to apply and the selection criteria for the program. And finally, as a reminder, by next week, a recording of this session, both the audio portion, slides, and the transcript will be available on our website. Dana?
I would really like to thank Dr. Eva Agard and Dr. Cornelius James for giving us their time this afternoon and for bringing their expertise and insight into the question and answers. I very much appreciate their partnership with the Macy Foundation. They are wonderful, wonderful colleagues. Thank you, Eva, and thank you, Cornelius. As for everyone, we hope you will stay in touch with the Macy Foundation for more information about our grants programs and our other initiatives, including podcasts, webinars, and blogs, and of course, the AI and Medical Education grants. Thank you so much for joining us today, and we hope to receive applications from many of you in February.
This concludes today's webinar. Thank you for attending.